Shall we? I'm just thinking it's about 3 or 4 minutes past. If we get going, it's being recorded anyway, this session, so if people miss anything, they can always go back to the beginning of the recording. So firstly, hi everyone. I think thank you very much for joining us. This is the first in our series of webinars. My name's Abby Hall and I'm one of the Devon AHP faculty project leads. And today I'm really delighted just to welcome Mandy, Caroline and Rhoda, who are going to be presenting. And they're really going to set the scene about the work that's being done in Devon for AHPs and the region more widely. I'm going to let them introduce themselves as we go through the presentation. Just some really brief kind of housekeeping. Please do remain muted unless you're speaking, obviously. We're going to have a Q&A session after all 3 presentations have been completed. So at that point, feel free to raise your hand and we'll come to you if you want to ask a question or you've got a comment. That would be brilliant. Please do just post any questions you've got in the chat as we go through, though. We'll do our best to get to answer as many as we can. If there's any we can't answer, we'll come back to you after completion of the webinar. I said we are recording this session and it's going to be uploaded to the Devon AHP faculty YouTube channel. So please obviously turn your camera off if you don't wish to be on the recording, but it's always really nice to see faces. If you're happy to have your videos on, that would be absolutely great. If you haven't and you'd like to, please just introduce yourself in the chat. You just get a really nice idea of who's in the room. I'm going to show this slide again at the end of the webinar, but it's just really a very quick promotion for the webinar series that we're doing. We've got three further webinars after today, and these will focus much more on kind of the support worker workforce, as well as kind of introducing the career development framework from a real variety of different perspectives. As a support worker, I'd thoroughly recommend the session next week on the 31st, as this focuses on how the framework's going to really affect you as a support worker. The next one, the 20th of September, is designed for managers and AHP leads to really help them understand what the framework means to them as managers. And the final one on the 29th of September is designed for people that supervise support workers. Just to really, can someone just pop their self on mute? So I think I'm getting quite a lot of feedback. I think is it Abe? Can you just pop yourself on mute for us? Thank you, brilliant. So the 29th of September is the final one in the series, and that's really designed for people that support workers and having those really important kind of career conversations. You should be able to scan those QR codes if you want to register. Oh, what are we done? Are you sharing yours, Mandy? Yep, that's cool. No worries. But I'll show that slide again at the end. So if you need to get the address or anything, I'll pop that in the chat. Okay, I think without further ado, I'm going to hand over to Mandy. Mandy, you happy to run your own slides?
Yeah, sorry, you were just getting a sneak preview
cool.
then. I was just in the background, just double checking that I could share my slides all right.
I was thinking, I didn't think I'd pressed a button to go onto your slides and it kind of appeed. So no, you go
doing
for it.
It by magic.
I shall hand over to you. Thanks, Mandy.
I've probably lost them all now. Right, let me just see if I can find them. Right, bear with me. I'm going to have to just do this again. Right, here they come. Slowly but surely. It's thinking about it. There we go. Can you see that now?
Yep, perfect. Thanks, Mandy.
Hooray at last. Sorry, it took a while to get there, didn't it? But hello everybody, thank you for inviting me to speak today. So my name's Mandy Tuckey. I'm a therapeutic radiographer by professional background, and I've been on secondment with Health Education England since November 2021 as a clinical workforce fellow. And previously to that, I was the programme lead on the undergraduate radiotherapy and oncology degree at UE Bristol. So I've got a HEI background. So I'm going to tell you just a little bit today about who Health Education England are, what we do, and then just thinking a little bit about what we do here, particularly within the Southwest, and hopefully that will lead nicely into the other 2 presentations that you're going to hear from this afternoon. So Health Education England is the education branch, if you like, of the NHS, and they really exist to be able to help improve the quality of life and healthcare services for the people of England. And we do this by really ensuring that the workforce, not only for today, but also the future workforce, really has the right skills, the right values and behaviours, including the right education, in the right numbers and in the right time and in the right place. So really, we are here to kind of oversee all the education and career development, workforce transformation that happens across all different health and social care professions. We work with partners to plan, recruit, educate and train the healthcare workforce, but we are really people-centred, and that's really, really important to ensure that actually we are really committed to that NHS constitution. We're driven by our values of responsibility, inclusiveness, fairness and confidence. And so really, our goals are to ensure that we deliver and reform education to produce the best possible future workforce. And we also need to think about how we can perhaps transform some of our current workforce, really to meet what our current needs are, but also thinking about what our needs are in the future moving forwards. And we really need to think about how we can do that in a really quality way. So our work programme covers more than 100 programmes, and we look at things right from planning to commissioning, and I'll show you a little bit more about that in a little bit. We also look at around sort of recruiting, developing healthcare staff in a range of different healthcare and community settings as well. So this is kind of health education in England on a page, if you like. So it works as part of the NHS. They ensure that actually, as I said before, we look at not only the current workforce, also the future workforce, but we need to really think about that quality. And we need to think about some of those guiding principles and objectives that are really, really important for us to be able to achieve that effectively. And there are 7 different domains that you may or may not be able to see down the bottom of your picture here that we use in order to be able to ensure that we are able to actually implement the work effectively of Health Education England. So having just told you a little bit about what Health Education England are all about and what we actually do, I just want to throw in a little caveat on that, in that actually Health Education England is going to be merging. We're going to be merging with NHS Digital and NHS England and NHS Improvement, and we are going to become one single organisation. So you may well still hear Health Education England talked about, but from April next year, we're all going to be under one umbrella called NHS England. The final organisation structure has yet to be fully decided. They're just in that process of transformation. There we go, the key word of the day, I think, in terms of thinking about how we're actually going to embed and develop the work that we actually do within health education into the new NHS England. So just a caveat on that actually you may well see, certainly from sort of April of next year, health education not being used in the same way as it has been used up until then, and we are, as I say, all going to be termed under the one umbrella NHS England. We will, of course, still be maintaining really close links with our colleagues in those other arm's length bodies and still sort of working really closely together. So in terms of how we actually organise and structure the work that we do within Health Education England, this is quite a nice diagram that I pinched from somebody else's slides actually, but it just goes it shows quite nicely that right at the top here you've got the government policies, you've got NHS People Plan, the long-term plan, so we've got some key statutory regulations that we must abide to, and we all are working towards, and I'm sure you've heard of those. They won't be new to you. They've been in the domain that we've been working towards for many years now. Within that, the Department of Health and Social Care mandates then to Education England and the other arm's length bodies and other organisations how we should be using those key white government papers and thinking about how we actually then implement that in terms of some of the work that we do within our organisation. That then gets developed into a Health Education England business plan, so where the business plan then determines exactly what the key drivers are going to be, what we're going to be working on as an organisation, and how we're actually going to be going about delivering on those key areas that we need to work on. That then gets devolved around into the different regions that we have within Health Education England, and then we will develop our own regional plan, because as you can imagine, the Southwest region may well have different needs and priorities compared to somewhere else within, say, London or the Midlands or wherever it may well be. So we need to think a little bit about how that national HEE business plan needs to look for us within the Southwest region. So then we look at how we're going to deliver that plan within region. And then just below that, what you will then also see is within our region, we actually have 7 what we call integrated care systems. So these are terms that you are probably starting to come used to hearing. They are mandated by the government from July of this year, and they are a partnership of many different organisations that come together to really plan and deliver joined up health and care services, with a sole aim to really improve the lives of people and the populations that they actually serve. So within your ICS, you will have a number of different organisations, you will have a number of different places that you may well not have heard of before, such as the People Board. You may well have organisations that traditionally may well have sat outside of those governing structures before, and it's about kind of bringing everybody together. Within the Southwest, we have, as I say, 7 of these integrated care systems. And so, oh, sorry, I think that's just, oh, it's going to, sorry, it's not going to show me that slide for some reason. There we go, I'll do it that way. So I've just shown here on the slide the 7 different integrated care systems that you can see here. So if you just look at Devon, where you are, you have actually got one of the biggest integrated care systems within the Southwest, and perhaps one of the smallest ones here is the Bristol and North Somerset, South Gloucestershire one, sorry. So in terms of your ICS and the population that you cover, then actually what you can kind of see here is it covers an awful lot of different types of organisations. So you've got your CCGs, you've got your NHS Trust, you've got primary care networks, you've got GP services, you've got care services, but you've also got higher education institutes as well. So as you can see, there's a lot of different organisations that are encompassed within an ICS. Just in terms of some of the population data, and I know that Rhoda's going to talk to you a little bit about population data in terms of what it looks like for Devon in particular, but in terms for us sort of regionally within HEE, some of the figures that we're looking at here, and I've just circled the one here around allied health professions, we've got around about 11,000 workers that work within allied health professions, and you can certainly see there in terms of the numbers of other different professional groups what that kind of looks like. And that's really important for us to know and understand what our data looks like, because that's going to really help us in terms of thinking about what our needs are and where we need to perhaps focus some of the work and investment that's going on. So within the Southwest for HEE, we will have that oversight for each of those different health integrated care systems. And again, some of the things that are really important, particularly for us as a region, is thinking about and knowing and understanding a little bit about what that population demographic looks like, because we need to know and understand, you know, if we look here about the population age, here about how many people we have over the age of 65, how many do we have under the age of 25, that's going to really help us in terms of thinking a little bit about where perhaps some of our challenges might lie, perhaps where some of our opportunities might lie in terms of some of our transformation that we're going to need to think about, thinking about a little bit about, well, what does our workforce look like in terms of occupation type? What type of people have we got living in a rural area versus an urban city or a town? Because that will all impact and influence the health and care that we deliver, but also the health and care and services that our population within the whole of the Southwest might well access. So these figures are really, and data is really kind of important for us to get the whole kind of region-wide picture as to what's going on, who have we got in our patch, and how is that going to influence and impact on how we actually deliver our regional agenda, but also thinking about that national agenda as well. And as I say, I know Rhoda's going to touch a little bit more on some of the demographics for Devon in a bit more detail when she does her presentation as well. But that just gives you a flavour of some of the things that we are interested in, particularly from a region-wide perspective in HEE. So in terms of HEE in the Southwest for AHPs, well, who are we and what do we do? I'm sure most of you know, but we are made up of 15 distinct professional groups. It keeps ranging from 14 to 16, but at the moment we are 15 distinct professional groups, and we make up the 3rd largest clinical workforce in the NHS. We make a crucial contribution to treating, rehabilitating and improving the lives of patients and being instrumental in delivering that long-term NHS plan. So we're a really, really vital group of core professionals. In terms of the different types of roles that make up allied health professions, then I think what we're really starting to see, and I know we've got a lot of different healthcare professions on the call this afternoon, they were actually made up of a really diverse group of individuals. And as well as that, we kind of work together really collaboratively in terms of some of the teams that we work with. But we have our support worker workforce, we have our assistant practitioners, our registered practitioners, and we're also now starting to see the development of our enhanced practitioners, advanced and consultant practitioners in many different areas, which is really great to see. You also have academics and educators, but you also have AHPs that go into research and into leadership and into management. So there's a whole range of different roles and areas of workforce development that potentially you could transfer into, and that just gives you just a little bit of a flavour as to some of the things that you can actually undertake as an AHP. So in terms of what we do as HEE to be able to support the AHP communities, well, in the Southwest we have a number of AHP workforce fellows that are led by Carrie Biddle. Many of you might have heard or seen the name Carrie Biddle. And Carrie is our regional lead for allied health professions. Now, there are 7 different regions in England, and each one of those has a different lead. Carrie's supported by Andrea, who's on the call this afternoon with us as well. And Andrea is our workforce development lead. And then working with Andrea is myself and Vicky Gill, and we are the clinical workforce fellows. So our role is really to help support Andrea and Carrie in their work, but also to work collaboratively with lots of different organisations, lots of different trusts, the AHP faculties, in order to really be able to help support them to be able to deliver on HEE priorities, and also to kind of help support them in terms of some of their work priorities as well. There are also lots of other HEE team members who you may or may not have come into contact with that work on lots of different projects and work streams in the Southwest. So some of you might have come across some of our digital team, some of our data analyst team, our business intelligence team. We have advanced practice faculty members. So a whole host of different people. We have comms and marketing, etc., etc. So I think the really important thing to say here is that actually we are really key critical connectors. We link in with organisations such as the HEIs, the professional bodies, arm's length bodies, and lots of other key stakeholders, as I've mentioned before, some of which are mentioned here. So these are some of the work programmes that we've got within Health Education England within the Southwest. And as you can see, they are far reaching. So you've got your AHPs here, but we also look at workforce transformation. We've got a public health arm, we've got a pharmacy arm, lots of different areas where Health Education England will be involved and will be able to help support and guide people within those working areas to be able to look at how they might be able to develop the services that they are delivering. So in terms of the programme team here in the Southwest and the work that we actually do, I think one of the things that we really want to ensure is that we really promote the value, benefit and impact of being a visible AHP and being an AHP leader at every level. And that doesn't mean to say that just because you are perhaps a support worker that you cannot have leadership skills and ability. And we know that that's something that's really key, and we're looking at implementing the Higher Development Award. I think particularly in Devon's going to be the pilot site, if I remember rightly. So again, really good opportunities for you to be able to develop and to be a really visible member of our AHP community and AHP family. But really, we need to think about supporting at organisation level, thinking about how we can help you to work on that workforce data, thinking about what some of the priorities are around new to role and preceptorship, supporting those early career workers, thinking about new models of care, and also thinking about how we promote those skills in terms of thinking about what you need to be able to deliver the workforce that you need. If we then look at the system level, then we need to think about how we can do that by influencing at system level. And this is what we do when we work with our AHP faculties, thinking about our councils and our local workforce action boards and the primary care training hubs as well, thinking about how we can get the word out there. And I'm hoping that many of you will have seen some of the fabulous stuff coming out on social media, particularly, for example, the workshops that were being put together by Abby. They've been flooded on Twitter and various other means. So really kind of getting the word out there is absolutely key to the work that we do. And then It's about how we collectively use our elbow, as it says here. We need to make sure that actually our voices are heard loud and clear. We need to be really shaping those actions and thinking about how we can raise that profile of the AHPs in line with that AHP strategy, AHPs Deliver, that's just been published in the last couple of months. So thinking a little bit about that, we then need to think about what our priorities are. Well, our priorities here in the Southwest are to thinking about how we can know, grow and retain the registered and non-registered AHP workforce in health and social care. Thinking about supply optimisation, and also to think about how we drive education reform and implement workforce transformation. And when you read that, if you've read any of the key healthcare policies and drivers, you will see that that aligns really closely with what is really pushing the agenda forward in terms of health and social care reform and transformation. So we then need to think about, well, what are our objectives? What is it that we really need to be doing in order to be able to achieve that? And how are we going to do it? What are our key enablers going to be? So some of the things that we need to think about here, if we're talking about how we grow and retain, thinking a little bit about building that AHP leadership that we've talked about, thinking about that capability and support that will actually drive that service delivery forward. Think about how we can actually look at the findings from the repair project and how can we implement that effectively to ensure that actually we really retain our workforce. And we know particularly within the Southwest that can be really challenging because some of our organisations are in highly rural areas. It can be difficult to encourage new graduates to come into role, and similarly it can be difficult to retain staff. So we need to really think about how we're going to be able to do that. So we start thinking about how we can work collaboratively with our faculties to think about driving those system actions forward. We've set up a number of regional workforce action groups for a number of key professions. So we've got occupational therapy, we've got diagnostic radiography, we've got ODPs, Operation Development Department practitioner, because we recognise and we know that the evidence is telling us that these are key areas where we really need to think about how we can help support our workforce in those areas. If we look at that supply optimization, then we need to really think about where we're going to get our workforce from. What is our pipeline going to look like? Where are we going to get the next generation of physios, OTs, wherever it may well be? And we also know that some professions are able to attract people into them much easier than other professions. So we need to think a little bit about what that's going to look like. Have we got options to grow your own? Think a little bit about apprenticeships, all of those different routes that you can potentially come into a professional environment, are what we need to start thinking about how we can work with others that have done really well in that area to see what ideas we can look to promote. And as I said, thinking about bridging that gap between education and employment. There's something called the flaky bridge, which is being recognised as being that transition between finishing your education and starting in your first substantive post or first qualifying post, as being really, really challenging and quite unsettling. And actually we need to really think about how we can support people within that transition of being new to role. And preceptorship, as we know, is something that's really gathering momentum at the moment, and there's a lot of work in that area. And we think that hopefully that will really help support people within that very early stages of their career and get them to start thinking a little bit about how they may well want to develop and progress their professional life. We also need to think about where we might get people from. So thinking about international recruitment, thinking about how we can encourage people that are perhaps retired and would like to return to practice, or potentially those that have actually left the profession altogether and how we can encourage them to come back. So that's what we're sort of looking at there within supply optimization. And thinking about how we drive the education reform, thinking a little bit about how can we work and educate and train differently. What is it that we actually need to be looking at in terms of getting the optimal workforce that we really need to be able to look after our population? So thinking a little bit about perhaps multi-professional education, how we can kind of upskill people to be able to undertake some of those roles that perhaps traditionally would have been undertaken by some of our other colleagues, such as medics, for example. We also need to think about how we can influence and share workforce solutions. And I think that's where COVID has been really advantageous for us, because we've been really given the opportunity to be able to demonstrate what us as AHPs can do in those times of adversity, and that actually we were really adaptable and really able to actually step up to the plate in areas where people didn't think that AHPs could traditionally do that. So we've got that momentum, we've set the precedent, and we can keep going with that. So I think we need to really start thinking a little bit about how we can kind of keep that movement going. So those are just some of the things that that we are looking at doing, particularly within the Southwest. So how are we going to do it? Definitely by collaborating, definitely by co-production. And I think co-production is something that you're hearing an awful lot more about now. And I think it's something that's really important, in that there was a slogan a few years ago that no decision about me without me. And I think this kind of ties into that really nicely. And that actually, if you're developing something for part of your workforce, whether it be students or your return to practice or whoever it may well be, then actually they need to be part of that design, and they need to be part of that production, because ultimately they're going to be living that experience. They are going to be the ones that this is going to impact on, and so they are going to be your experts, if you like. And so these are the people that you're going to really need to have in your kind of design team, if you like. But you need to start thinking a little bit about how you're going to work collaboratively to be able to kind of really address those key drivers for transformation. So some of the things that we've got in the Southwest, we've got our AHP faculties, we've got our workforce action groups that I said, but we've also got lots of you guys out there in trusts and organisations that are undertaking HEE funded projects. So you've got a really good opportunity to be able to shape some of the work that you're doing within your organisation and within your clinical areas as well. We've got secondment opportunities, such as what myself, Vicky and Andrea are doing. So we've got opportunities to be able to come and work with Health Education England and other arm's length bodies to be able to really see and understand a little bit about what we do and how we can influence and work effectively, and hopefully kind of give something back to our organisations when we go back there after our secondments, to be able to see how we can actually look at workforce transformation ideas. Then we've got lots of funded work streams, and I guess some of you may well have been involved in lots of different projects, or you might have talked to colleagues who are doing something you thought, oh, that's really interesting, and they might have said, oh yeah, no, it's a Health Education England funded project. So there's lots of different funded work streams out there that are looking at lots of different things, and part of the role that we have within Health Education England is coordinating and ensuring that we know and understand exactly what's going on out there, so that we can get that overall picture in terms of what's going on within our region and how that feeds into the national work. So in terms of what you are actually doing in the Southwest, these are just a couple of examples that you might well have heard across. So we've got the support worker project. I've just given you some pictures here from one of our other faculties in BSW, but I know particularly within Devon, you're working really, really hard in terms of trying to implement and deliver the support worker framework. We've got the AHP faculty meetings, lovely little picture there, in terms of thinking about how we can actually monitor and know and understand exactly what's going on within the faculties and within the wider region, because those faculty will then feed into what's happening region wide. We then feed into what's happening nationally as well. Lots of different opportunities for sort of transformation programs, and you can see some examples that Carrie's popped on Twitter in terms of how we're using social media to really get the word out there, and it's a really good opportunity for you to be able to connect and touch in with other people who might be doing an area of work similar to what you're doing. We're also doing lots of work in terms of preceptorship, and also lots of work in terms of data collection, which is a biggie, particularly within the Southwest region, but also I know within Devon as well. So just to finish off, I just want to end by just highlighting the AHP's strategy for England, which is AHP's delivered. This was published back in July, and this is the next stage on from the AHP's into action, which was the previous strategy that was published for AHPs. And I just want to draw your attention to some of the key themes and some of the areas of focus that strategy is now delivering on, because you will hopefully see that actually that really aligns with some of the work that not only we in HEE are doing, but also you guys are actually doing within Devon as well. So What the AHP strategy is really after is ensuring that we have got AHP champions that are diverse and inclusive of leadership. And by that, we need to know that we've got AHPs that are in the right place and the right roles that are going to be able to make a real difference. So that's about having your chief AHPs in post. Thinking about having people in the right place at the right time with the right skills. And that doesn't necessarily mean that you need to have a physio to be able to do X. It's about having that person that might have the right skill set to be able to do X. And it's just thinking a little bit about how we know that we've got the right people in the right place. We need to really commit to research, innovation and evaluation. And we know that there are some professional groups that are fantastic at it, but we also know that there are other professional groups, and I put my hand up and say therapeutic radiography being one of them, where we do some amazing work, we do some brilliant stuff out there, but we just don't shout about it loud enough. We don't get our publications out there. And therefore you can then get yourself in a position where actually you can stifle that innovation. But we need to really start thinking a little bit about some of that work that we do and any kind of research that's undertaken to ensure that it's got that AHP accent to it, so that actually we are included in some of the research and the innovation and the evaluation that's going on out there, because we do need to be really at the heart of everything that goes on as well. And also thinking about harnessing digital and innovation through data. We've already seen a little bit about how we can use data really effectively to help us think a little bit about how we can model and plan our workforce in terms of what the demographics look like. But we know from COVID how we've been using digital data and how we've been using technology to really help support some of the work that we do. And I think it is about ensuring that actually it's about as a support, not as a replacement. And it's about thinking about how we use that digital and that technology effectively to be able to really undertake the work that we want to be able to undertake. And so finally, just the 5 areas of focus. It's about ensuring that, you know, people come first. And I think as AHPs, we would all agree that actually the communities that we serve come first. The work that we do, we always strive to be able to do the best for our people. We really want to optimise care, and we really want to think about how we can address health and social care inequalities, but also inequalities within the working environment for us as well, to ensure that actually we are represented where we should be represented. And actually, if you see inequality, that you are actually able to kind of call out those biases and say, well, actually, no, that's not correct and that's not how it should be. And we need to think about how we can work effectively to ensure that actually we've got that social justice. Environmental sustainability, green AHPs. There's a pledge to try and be net zero and carbon neutral as much as possible. We've seen a lot of work towards kind of paperless, paper light departments, and we need to think a little bit about how we can do our bit, thinking about, for example, those of you that go out working in the communities, if you have using pool cars, are they electric cars? Are they cleaner for the environment? Are we doing the best that we can in terms of thinking about our carbon footprint? And finally, it's about strengthening and promoting our AHPs in the community, getting the word out there that we are really a valuable piece of our workforce. We can really make a significant difference, that actually, as long as we are part of that community and we are there to be able to help and support and promote the work that we do, then actually we can go from strength to strength as AHPs. So can we create more movement? Oh yes, definitely. I think we can. I think the future is bright. The future is AHP, and I think we've got a really golden opportunity to really make some changes. And we've got a lot of momentum behind us. So hopefully, with the help and support of everybody that you've got around you, and the help of Health Education England South West, we will continue to be a force to be reckoned with. And that's the end of my presentation. I think we're going to do questions at the end, aren't we, Abby? But thank you ever so much, everybody.
That's great. Thank you so much, Amanda. It's a lovely overview of all the work HEE are doing. So much appreciated. Thank you. I'm going to hand over to Caroline. Caroline, do you want me to run your slides, or are you happy to?
If you don't mind running my slides, that'd be great.
Absolutely fine.
Thank you.
Just make sure I've got the right screens up. There you go. Is that showing?
That's lovely. Thank you. Hi everyone, my name's Caroline Haig. I'm the Principal Occupational Therapist at Devon County Council, and I'm also the Devon Allied Health Professions Council Chair, and I'm going to tell you a bit more about that Council today. I just wanted to acknowledge and thank Abby for all she's done to bring together these webinars, and it's a really good opportunity for us to talk more widely around the kind of work that has been happening, perhaps a bit more behind the scenes whilst we've been sort of dealing with the pandemic and things, but actually an opportunity for us now to kind of showcase that work that's been happening. And I'm particularly close to my heart that you're pushing forward work around our non-registered and support worker workforce, because I have developed as a support worker when I started as an OT assistant in the RD&E in the late 90s, and you know, it's so important that we optimise the brilliance of our support worker workforce. Yeah, thank you, big thanks there. So in my talk, these are some of the things I'm going to be running through. So there'll be hopefully things that will chime from what Mandy's just spoken to you about, but hopefully I'm going to give a bit of Devon context to that. So we're bringing it down from the southwest to Devon in what we call our system, our health and social care system. So I'll give you some context. I'll talk about the integrated care system and partnerships. I'll touch on strategy, particularly local, acknowledging what Mandy has also just talked about in terms of the national AHP strategy. I'll talk to you about the AHP Council, how you can connect, and then a little plug about AHP's Day, because I can't help but do that. So we'll go to the next slide, if that's okay. So I know many of you will know who all the allied health professions are, but in case you don't, all of our allied health professions are wrapped around this diagram here. So it's just a helpful reference point, because there's quite a few of us. And as Mandy said, we're you know, a diverse by profession, and we cover many different clinical settings. So yeah, we're a pretty brilliant group of people, really. And in fact, now the third, collectively the third largest population or workforce working within the NHS and beyond in sectors. So if we go to the next slide. So Mandy mentioned the word transformation. There is a lot of transformation and work that needs to happen, and sometimes that can get pretty exhausting when we're trying to achieve the day job. And so I thought it just might be helpful to just give a bit of context around what the major drivers are for that transformation and change, particularly related to Devon. So the national policy and legislation, so we know about, or we may or may not know about, the NHS long-term plan. So the long-term plan, I quite often say to people, if you're wondering why there's so much change going on and what's happening and the direction of travel, read the long-term plan, because that's the direction of travel that we're all working towards. So it is worth a look at that, and you can look at an executive summary with the overview with a few bullet points, which breaks it right down. And so there's things like, yeah, the long-term plan, there's the people plan, the new health and care bill, which is really heavily encouraging us to collaborate wherever we can across health and social care, across sectors, across communities. And yeah, it's not being suggested as a would be nice to do, it's a let's do this now, and let's make it happen. So really important to have that vision and direction, but obviously we need to try and make those changes and things happen, because it's quite a different approach to how we might have worked a few decades ago. So particularly, as we know, working in Devon, we have an ageing and growing population. We know that we increase in long-term conditions, health inequalities. We're seeing increase in mental health and well-being. And I think as a system, we perhaps have the oldest population in England. And I heard a statistic recently where someone said in 10 years' time, we will have the oldest population in Europe. So we, you know, really do have an ageing and growing population. So for Devon, we know that there's clinical evidence that recognises challenges with our current and traditional models of care and support, and ways of working that we really need to look at to see how we might do things differently. We're all experiencing every day the significant staffing challenges, we are in a challenge position in Devon, as are many systems, in terms of finance, and we get feedback from the people that we support and that use our service, and we know that there's always more that we can do to continue to improve and develop our services to optimise outcomes for people. There's also estate and infrastructure challenges, so how we might be thinking about how we're digitalising what we do, but also making sure that where we do need facilities and estates, that it's fit for purpose and sustainable for the future. And another area is around improving our environmental impact. There is a lot us AHPs can do to support that, as well as other professions and our wider workforce. And just wanted to make a little plug for the Greener AHP Hub, which is available. Perhaps I'll put a link in the chat bar shortly. So that is a website that's been developed by NHS England, which includes loads of case studies and examples of things that people are doing across the country in terms of greener NHS, and there's some really interesting, helpful suggestions and ideas on that hub. So yeah, worth a look, and if you have any examples, you could obviously contribute your case study too. So if we go to the next slide. So the integrated care systems. So initially referenced in the long-term plan, integrated care systems are now officially how we're working. So we are One Devon ever since the 1st of July. And so that means that all of these organisations are brought together under leadership to collaborate, integrate, and to improve services across health and social care and in our communities across Devon. So with the key priorities being here on this slide, so to integrate care, to improve health outcomes, to tackle inequalities, to enhance productivity, and to support social and economic development. So as Mandy said, we are a pretty big ICS. We have 4 acute trusts. 4 acute trusts, sorry, I don't know why I hesitated that. We have 4 acute trusts and community services, mental health services. You'll see our local authorities. We have Torbay and we have Plymouth and we have Devon for our local authorities. So there is, and as well as our SWAST and our primary care colleagues, and also the voluntary community and social enterprise sector. So there are a lot of us all coming together to work with bodies like Health Education England, NHS England, to make this change happen. So if we go to the next slide. So what does the strategy look like for Devon in terms of achieving this? So the vision for One Devon, and you can find this on their website if you want to have a look at in a bit more detail, is around equal chances for everyone in Devon to live long, happy and healthy lives. And here are the 6 key ambitions that have been set out for us in Devon. So again, expect changes and things happening to be associated with these ambitions that are laid out here. So effective and efficient care, and achieving that through collaboration across our systems and organisations. An integrated care model, so that's what I've been talking about, so that we can really join up care for the population of Devon. The Devon Deal, a citizens-led approach to health and care. So where we're working much more closely with our communities, understanding what their health needs are and developing services and support around them, rather than us developing services that might be beneficial for people. We're actually working and co-producing those services with people from the offset. So children and young people, working with children, young people and their families. We want all children and young people in Devon to have the best start in life, growing up in loving and supportive families, and to be happy, healthy and safe. So Digital Devon, we'll all have had some experience recently of the digitalisation of medical records, but obviously we can go much further with that in terms of digital technology, telecare, technology enabled care and support, and such things. So a huge drive around digital, and equally well in Devon. So working together to tackle physical health inequalities for people with mental health, learning disabilities, and or autism. So I think this information around those groups of people have been around for quite a while, but actually I think we're looking at putting plans together to make sure that we really do focus and try to address those health inequalities and really challenge ourselves on how we deliver services to make sure that we're getting things right for people and everyone has an equal opportunity to be well in Devon. So on the next slide. So we're working with the strategy that I just showed you for Devon, but for us, for allied health professions, we obviously are lucky enough to have this national strategy that has just been launched. So many of you will have heard about the AHP's Into Action strategy before, and this is the next iteration of that. I'm obviously not going to go into that in great detail because Mandy's just brilliantly articulated that, but what is I really would recommend you having a read, because there is a full strategy, and again it helps to support us with the direction of travel and how we can help Devon to achieve many of the strategy that I showed on the previous slide. I certainly found the AHP's Into Action strategy a really important enabler to support AHPs to demonstrate how we can make the changes that are required across our health and social care systems, so that we're not forgotten, and we're very much part of service transformation and change from the start, from the offset. So next slide, please. Okay, so to tell you about the AHP Council, what's the function of the AHP Council? So I'll just go through the list of things here. So collective action, working collectively as part of a wider system architecture to support the quality, operational delivery and financial priorities of the ICS. So it's encouraging collective action as opposed to competing against each other. So what this looks like at the moment is that we have a monthly meeting with the most senior AHP leads from organisations coming together, where we're discussing issues and topics around quality, operational delivery, finance, and then workforce. And we're always looking to extend that the representation to that meeting to make sure that we're covering off all allied health professions. So the next is identifying service and operational delivery risks and issues, and escalating where appropriate. What's really helpful for the AHP Council is not only are we linked to our Devon kind of system senior leaders, we're also linked to our regional colleagues, like for example at Health Education England and NHS England and Improvement. And it also means that if we have any significant issues, we can raise those issues regionally or even nationally. So for example, the council raised issues around OT workforce and recruitment. We raised that to the region, and the region responded by setting up the Workforce Action Group, and it's been similar for podiatry colleagues and other colleagues as well. So it really does mean that we have an opportunity to raise risks and issues that you're telling us that are happening in the system, and actually taking action to try and address them. Sometimes it can be hard to address things just within our organisations, and it's better to get our heads together to think about how we can navigate around some of the barriers that might be there. So strategy planning and activities. So we established as a council in January 2020, so pretty much at the start of the pandemic, and really our focus during that time has been to be together, to provide support for each other, to try and have consistent communications from region and nationally down to be feeding into our teams. But prior to that, we had developed our own local AHP strategy based on the integrated care system strategy that was probably published 2 years before that. So that's kind of being superseded now by our new strategies, but it's still relevant, and I will show you some of the things that we've achieved in terms of our strategy and planning. So supporting integrated care system, long-term plan, strategy and implementation. So sharing and spreading good practice and research. I think one of the biggest benefits we've experienced from being together is that we can share all the good practice and the things that are happening with each other. And it means that we don't have to recreate the wheel every time we're doing new things. We hear about innovative practice that's happening, and we can share that so that we can develop our services and deliver a bit of a faster pace than we might if we were starting everything from scratch. So that's really important that we do that. So the workforce service and transformation. So this all happens through the AHP faculty. So the AHP faculty feeds into and is overseen by the council, and that is brilliantly led by our AHP faculty chair, Rhoda Allison. Thank you, Rhoda, for stepping up. None of these are official system roles. So what I'm doing as an AHP Council chair, and also what Rhoda Allison is very much based on discretionary effort and wanting to do the right things. We're not necessarily appointed to those roles. So really appreciate any kind of effort and support that anyone brings. So the AHP faculty is about sharing, developing and enhancing skills whilst articulating the unique contribution of each specific AHP. And you've already heard quite a lot about the AHP faculty and the focus on workforce, and Rhoda will talk about that much more in a minute. There's also an AHP Council maturity matrix, which allows us to support and measure the quality and success of the AHP Council. And ultimately, what it's helping to do is to provide a voice to allied health professions in Devon. So we have managed to secure AHP places in all of the integrated care system meetings alongside nursing and medical colleagues. So that's been really important for us. And I think that's an important first step. What we want to do is, now we've got that space in the room, we want to make sure that we are feeding in everything that's happening within our organisations, that we are influencing the direction of travel, and we're demonstrating the impact we can have as allied health professions in Devon. So next slide. So this, this fishbone diagram, I guess you might call it, is the foundation of our original strategy, which we developed a couple of years ago. So there were 4 main domains that you can see here: service transformation, healthy communities, collaborative leadership, and dynamic AHP workforce. And you'll see there in green many of the things that are ongoing and that are active. In blue, the priorities to be planned and collaboratively moved forward. Many of those things are already happening in individual organisations, and then where we've completed actions. So we've very much been focusing on establishing the council. We have bid for quite a lot of money from Health Education England, which has enabled us to establish things like the AHP faculty, and to have people like Abby in role, as well as Matt as project leads for the faculty. You'll see for yourself all the various different things that we're doing or that we plan to do. It would be fair to say much of this was stored during the pandemic. So we're going to have an opportunity now later on in September to review our strategy aligned with the Devon strategy and with the national strategy, to look at what we've done, what we need to move forward in the strategy beyond 2022. It's been a challenging time through the pandemic, but it has been fantastic to be able to work collaboratively with AHP leaders across Devon. There's lots more we can do though. On the next slide. Okay, so I just wanted to share with you this slide. If you're at all interested in reading more around integrated care systems and AHPs, NHSE and I have just published a document which shares everything about AHPs in integrated care systems in much more detail, but I just wanted to share with you here. So you'll see in the box here at the bottom that's outlined by red, there's the ICS AHP Council. You'll see the faculty linking into that, and then you'll see the connection to all of the system, well, it's got boards and groups there. So for us in Devon, that terminology isn't quite right. So we have the executive workforce group. So that's where we feed into in terms of the faculty. And then we have the clinical and professional cabinet, where we would feed into in terms of influencing and contributing around clinical and professional issues that are occurring across Devon. You'll also see just above the red box our connection to the regional AHP boards, and then going up to our regional colleagues at NHSE&I, and then how we link with the CAPO team, the Chief AHP team, which has our Chief AHP officer leading that, who's called Suzanne Rastrick, who many of you may or may not know. Okay, on the next slide. Okay, so here's key priorities for the next 5 years. There's no real surprise there based on the strategies that you would have seen. Some of the things that we're going to be sort of taking forward. So we say about AHP contribution to COVID recovery. So that will be particularly thinking about our emergency and urgent care and elective recovery and areas such as that. I've talked about the strategy development. We're talking more about workforce and what's happening, environmental sustainability, really making sure that AHPs are core and have a strong voice in the integrated care system, making sure that our priorities in the council align with the integrated care system, making sure that we're pushing forward on the equality, diversity and inclusion agenda, investing in leadership. I know that there was a reference earlier to working with our chief AHPs. We are really aware that we don't have chief AHPs as such within the Devon system. So we're really trying to strongly advocate that that is a direction of travel that is supported, but we're still working on that. And then the people first approach. If there's anything that all of us are completely together and wanting to collaborate to go forward, it's about focusing on people, developing our services with them, making sure we're being person-centred, using the information we have about population health to develop and deliver our services, working alongside not just our AHP colleagues, but our colleagues and workforce more broadly across health and social care and voluntary and community sectors. So next slide. So I just wanted to just share with you some of the things that you can do to connect with your council. So I send out a regular email summary that comes out from the Southwest, from the HEE and NHSE&I, but also if there's any requests from the system or anything that we're looking for a specialist AHP for, anything, I use that group to send out to. So if you're interested in being part of that group and you're part of the AHP workforce, please do contact my PA Kathy. If you're thinking your senior leaders in AHP might not be on the council, have a conversation with them. I'd be really happy to talk to them and encourage them to join, as we're really keen to make sure that we have representations from across all of our allied health professions. And speak to your managers and your AHP or therapy leaders to volunteer and get involved and offer your expertise for projects and initiatives that come forward, which is obviously a great CPD opportunity. Please do share any ideas or suggestions that you have that might help us to deliver on any of the national strategies. We're all in this together. No, not one person has got all the answers. If you want to share any examples of celebrating success of our AHP workforce, things that you're doing and the impact you're having on people's lives, we'd absolutely love to hear from you. And if you are looking at developing or taking forward any projects or initiatives, it might be that we have the contacts and information that we can share with you to make that support that and make it easier for you, connecting you with people that might have already done it. And finally, I have there to celebrate AHP's Day with us, which is on the 14th of October. So you can showcase what you're doing in the next role. Or in your role, sorry, not the next role. So if we go to the final slide, it is all about AHP's Day. So we are going to be continuing to celebrate, appreciate, inspire and connect on this year's AHP's Day, which is the 14th of October. So last year, in the tiny writing, you don't really need to read anything. I'm just showing you that was the programme. We ran lunchtime sessions from 12 till 1 all through the week, and we had fabulous presentations from allied health professions, workforce across the week, showcasing what they're doing. We recorded the sessions and we shared them widely, and it was really well received. Many of these examples have also been used in some of the developing strategies that are happening in the integrated care system. So it is a fabulous opportunity to showcase what we're doing and the impact that we can have. So I look out for the request for presentations, and do consider yourself doing a 10-minute presentation to showcase the brilliant work you're doing as an AHP workforce in Devon. And I think that's it from me. Thank you.
Thank you, Caroline. That was absolutely brilliant. Thank you. I'm going to hand over to Rhoda. Rhoda, do you want me to run your slides as well?
I don't actually, because I'm going to share my own. I'm the person that's constantly tinkering with my slides right up to the point I actually speak. So forgive me, everybody. You're oh, you don't want to see that. Sorry. You want to see this. Sorry, a bit of a delay. It's all a bit hot and.
Checking, Caroline, are you going to be around for the end just to have questions if there's any for you?
Yeah, sure.
Super, thank you.
Sorry, I won't go into slideshow. It's all gone horribly wrong. Can you see this okay, everybody?
Can see it, just not in slideshow, but it's seeable.
I think it's just frozen, hasn't it?
You can try the little icon down the bottom next to your on the right hand side. It looks like it's like a little TV next to the book. That will, yeah, see if that will work. Nope.
No, I think it. Okay, I tell you what. Yeah, please, Abby. So I have actually updated the slides, but I'm just going to have to confess as we do it. So what I tweaked a little bit.
Kirsty said share and unshare again. So do you want to give it one more try? Just in case? No.
No, I'm not going to go there. Go for it, Abby. Sorry, everybody.
There you go.
Right.
That's sharing.
Thank you. Right, so thank you everybody for the chance to talk. I'm Rhoda Allison. I work at Torbay in South Devon, and I'm, as Caroline said, the chair of the faculty. So if we have the next slide. So I'm really just going to whiz you through a bit closer to the data, so about our population, a bit closer to the data about our workforce, and then just whiz you through what we are actually working on as a faculty. So next slide. So this is a bit of information about our population, and the graphic on the right is from the GESNA, which is the Joint Strategic Needs Assessment for Devon. So this is on the Devon County website and is available it's in the public domain. And you can filter the data for your own specific area. So this is Devon data, but you could go in and have a play and look at your local hospital area or your local place-based area. So it's a great resource. So the little graphic on the very right of the picture is actually a description of our population by age. So each of those bars is a 5-year period, with the exception of the bar at the very bottom, which is the number of people we have in Devon aged 0 to 1. And the very top, which is everybody that's over 90, every other bar is a 5-year span. And on one side we have all the women, on one side we have all the men. But the story behind this is the widest bars, so the greatest number of our population in Devon, are really the people that are over 50 and under 74. So they have the biggest, densest populations, whereas the smallest are the people over 90 and under 1. But for the 5-year bits, where you might expect it was a bit more even, the biggest bulge is actually in the older age group. And this is a reflection of the baby boom after the war, in that there was a big boom in children being born, which then continued for a period of time. So what will happen is, as this baby boom ages, the numbers of people over 80, over 85 and over 90 will also increase. So obviously there'll be less than the bars are now, because there's that natural people die, but actually the numbers of people over 90 at the moment is a reflection of the fact that there were less people born at that time, as well as the fact that people have got older and died. So over time we will see that big bulge getting gradually older. And in the little graphic at the bottom on the left actually shows that projection. So the blue area of the graph is the numbers of people that are 85 and over in Devon over the next 20 years. And what it's basically showing is that there's going to be a 40% increase in the next decade in the number of people over 85, and a 17% increase in those over 65 to 84. So we know that people use the most services in the last years of their life. So this is going to be a huge challenge for us in Devon with our aging population. The other important point to note is that on the graph of the age bars, there's quite a lot of people that are aged between 50 and 65. So they are still working, and some of those will be our workforce. And what you will see is the number of people that are younger than that is quite a lot less. So not only are we going to be challenged by the fact our population of people we're looking after is going to be getting older, we're going to be challenged by the fact that the population of younger people that we will draw our workforce from is actually getting a little bit smaller. So it's a challenge all round moving forward. Thank you. Can we have the next slide? So this is a little bit about our actual workforce. So this is from some of the data we've been looking at, and if you've been working as an AHP workforce lead, you'll have been doing a lot of work cleansing the ESR data. This is to try so that we can try and start to get some sense out of planning for the workforce. So this is the graphic of all the registered AHPs in Devon. And what we take away from this is that our workforce is 80% female, 20% male. It's probably not really a big surprise, is it? But that we're a relatively young workforce. So if we look at the staff age profile, the biggest group of our staff are actually between 30 and 34. But we actually have almost 15% of our workforce are over 55. So are potentially getting towards the point when they might be considering retirement. Obviously, with the change in the NHS pension scheme, people are now expected to work till 65. We still have a number of people who might have special class status who have the ability to go at 55. And obviously not everyone continues to work until 67. So that's our registered AHPs. If we go to the next slide, this is the data we have about our support workers. So it's similar. Our data tells us that currently 1/5 of our overall AHP workforce are support workers. And again, over 80% of them are female, 83%. So this story, we actually have over 20% of our AHP support workers are over 55. So whereas we saw with registrants, our greatest number of registrants was 30 to 35, our greatest number of support workers is actually 50 to 55. So that's a bit of a challenge for us as well, thinking about our support worker workforce moving forward, that we are going to need to attract some younger people into this workforce as people get ready to retire. Next slide, please. So this is a little bit about where our support workers are. I don't know if I've got a view which actually, I hope you can all see the bottom, which actually shows this is by organisation. Now, I have to confess, this was one of the graphs I changed. So the bar on the far left is Torbay and South Devon. Then we have Exeter, then North Devon. I think the number for Torbay and South Devon is probably a little bit overstated. You'll see why on the next graph. And then we have less support workers in DPT and the smaller organisations. And according to the ESR data, we don't have any in Devon County. Now, that might be because the source of the data. So there is still ongoing work to do to actually check out this and go back to the leads and say, have we got this right? Are we cited on everyone we need to? Can we have the next slide, please, Abby? So this is then actually a little bit about where support workers work, what professions they support. And we know that this data is quite difficult because we have many support workers that work across professions that perhaps, for example, support OT and physiotherapy, or OT physiotherapy and speech and language therapy. And it's been difficult to actually work out whether we all enter that data the same way. So you need to take this with a little bit of a caveat. I also am slightly nervous about the diagnostic radiography bar because that suggests there's a lot of people doing support workers for diagnostic radiography in South Devon, which I think is probably not quite right. So you might want to take that one with a little bit of a caveat. But you can see, I think the story is probably fairly right. We have a large number of support workers in physiotherapy and occupational therapy, and much less in the other professions. So we need to start looking at this data as a proportion of each professional group. So, for example, I might easily believe we don't have that many in dietetics because dietetics is a smaller workforce, but we want to start looking at what are the proportion of each workforce. And we are collecting that data for some work we are doing with HEE to look at projections for the workforce in the future. The next slide, please. So what have we learned so far? So we know it's a complex system. We work in with Devon, lots of organisations, and we know we've got this very ageing population, and we are ahead of the rest of the UK. And I guess from what Caroline said, perhaps potentially getting ahead of Europe. So we are going to be the test bed of how we address this challenge. And I'm not sure we're going to be getting a lot of help from the centre until we probably get into the weeds of it. So there are a number of things we are needing to think about. So one is our model of rehabilitation services. Now, I appreciate not every AHP profession is involved in rehabilitation, but it is a large part of what some of us do. There was a model published by NHS England in 2016, trying to refresh what we do in terms of rehabilitation and refresh our offer. And recognise the real importance of self-management and peer-delivered rehabilitation. So it's not just about what statutory services are delivering. There's probably quite a lot of unfinished work in that space, because that high number of old people, we're never going to have enough staff to deliver the sort of traditional model of care that we have been doing. So there's some work there. There's the work that the faculty are currently doing, which we're going to talk about in a moment. And as my colleagues have mentioned, there is the work in the new strategy. And I've particularly circled the part of the new strategy called Optimising Care, because that is particularly about our workforce model. Do we have the right people? Have we embedded allied health professionals job planning? Have we really understood the demand and capacity of allied health professionals? And the answer is we haven't yet. Not like our colleagues in nursing who have done a lot of work about what safe nursing staffing looks like. We have some work to do in that space. And I think this is my last slide. So as the faculty has representatives from each organisation in Devon. Those are mostly your workforce, AHP workforce leads. We have some roles that are actually funded, so aren't just discretionary effort, and we're very grateful to Abby and Matt for all the work they do for the faculty. As we said, we report to the council, and the projects we currently have, so our projects are, we agree with HEE, so they have a very clear work plan of what we need to be doing, but what we've currently got on our work plan are making sure we have really good quality data so that we are clear where are the biggest challenges in our workforce. We're doing some work on equality, diversity and inclusion, some work on expanding student placements, work on returning to practice, and as part of today on the support worker framework. And these are all different elements of how we make the most of our available workforce. We have also just submitted a bid to HEE for some further funding, and the particular areas we are looking at with that are around leadership. So, and that relates to what Caroline talked about, making sure we have really good leadership of AHP services in terms of AHP leads, but also we feel we need to do a piece of work about leadership throughout the whole workforce. So everybody has a part of leadership within their role. So that includes our new graduates, our support workers, everybody. So we want to take a look at how is leadership embedded in everyone's role. We're also looking at preceptorship, as Mandy mentioned. We know that that can be a fragile area with people who have just graduated, then choosing not to stay within AHP professions. So we want to look at how we can make that preceptorship, that early career, a really positive experience. We are also looking at, sorry, my slide is really difficult to see, the optimising care, safer staffing element, and we recognise that we are very committed to how we make the most of support workers in Devon. We recognise there is a lot of work to do there to challenge ourselves to understand, have we got enough support workers to support each profession? Have we really offered our support workers a good offer in terms of career progression themselves? So more work to do in that space. I think that is me. Thank you, Abby.
Thanks, Rhoda. That was brilliant. Much appreciated, and thank you to Mandy and Caroline as well. We've got just over 10 minutes really for questions. So I think Mandy, Caroline and Rhoda are all here. So if anyone's got any questions for any of them, that would be absolutely great. Feel free to pop your hand up so you can talk, or pop a question in the chat. Just to make you aware, we will share the recording and also the slides, so people have got them available if you'd like them. So they'll be sent around afterwards as well. So, but any other questions, please put your hands up. Not sure if everyone's stunned into silence or you've just covered it so well there's no questions to ask.
If there's no questions for us, I have a question for the audience.
Go for it.
Which would just be, does that graph of support workers feel about right? Does that feel right from what you all see? That we have quite large numbers in physiotherapy and occupational therapy and very, very little in other roles. I'm interested in people's perceptions.
From a therapeutic radiography perception, I would say that's probably about right. If anything, possibly higher than there would be. I would say it's possibly a bit high.
Yeah. The revised graph was actually less.
Yeah.
The data's been very, very hard to gather, and I think a lot of that is because of the ESR data not being accurate. So the workforce leads have been doing a massive amount of work to try and cleanse this data. So we hope that when we repeat this kind of exercise or these graphs in the next few months, it'll be much more accurate and give a much clearer picture. So I think it will really be testament to the work that they're doing and just how inaccurate it was to start with. And I think that's been a big issue. So Virginia, did you want to come in?
Yeah, I just had a question really around the role of circumstances where AHPs are working in generic roles. So, for example, where someone is working where their job title is practitioner, and they then have a support worker working alongside them, whose role, so for example, in my service would be dementia support worker. So they may be being supported and clinically led by an occupational therapist, but their job title wouldn't reflect that at all. And how those people are reflected in that data, but also how we support them in terms of their identity within this sort of work and this development.
Rhoda, would you be happy to answer that one?
Sorry, so was that question primarily about how we collect the data on them and we've got them apportioned to the right place?
Well, partly that, and do we feel that they would therefore be picked up through looking at ESR and looking at that workforce, but also, you know, in terms of their identity as an AHP support worker, you know, how do we support that sense of that everything we've been talking around today actually relates to them?
So I guess the first bit, the AHP workforce leads were put in place to try to make sense of the local ESR data. I think there is a piece of work to do as a group, as a faculty group, about how, do we all apply the same logic when we're trying to put data into ESR, or does one organisation do it one way, another do it another? So I don't think we're convinced we've completely bottomed it out yet, and I think we probably all think it's never going to be completely perfect, but we want it to be good enough that we can make some sense of the data. So I think there is a piece of work to do about the recording. In terms of the skills and the opportunities for people, I would say that's for us, isn't it, locally, about how we make it clear to people, you can identify with this group, this is, and make it clear what career paths might be. I guess if people are shared with nursing, I don't know if that sometimes gets muddled. It'd be interesting to know how many AHP roles we have that are actually shared with nursing. But I think there is probably a local piece of work about how we reach out to those people and say, if you're doing something like this, you are, you know, get on board. And I know, for example, because my role goes across nursing, our nurses looked at the AHP support worker framework and thought it was fantastic, and thought, gosh, why didn't we have something like that for nurses? So yeah.
Just looking at a couple of comments in the chat, I think Kirsty's posted to say that they don't seem to be that large numbers, and struggling to get rehab for patients. And I think what we're not saying is that there's lots of support workers or lots of registered staff. What we're saying is it doesn't quite fit what people are feeling on the ground. So it looks like it's more than there actually are in existence. And that's a lot of the work around the optimising care piece of work that Road has done, is actually looking at what staffing levels should look like rather than what they do look like and actually what's needed. So I think that's probably described that a little bit. It's not that we think it's too many, it's more than we think actually there are on the ground. Caroline, did you want to jump in?
Yeah, I just wanted to pick up on the point that was just made. I mean, on the stats there, it said about Devon County Council, and I know we're not on ESR, are we? But actually, we have social care assessors who work alongside our occupational therapists, who are very much doing an occupational therapy focused role, but all of our support workers are called social care assessors, and some are very much doing the social work role, some are doing a little bit of both, you know. So I think it would be really helpful to kind of work that through a little bit, because I know many would be really keen to be part of the AHP community.
Yeah, I think that just goes to show that a lot of roles are termed something slightly different, even though they may be aligned with a certain HP profession, they're not actually called that. So I think there's in lots of organisations, there's quite a lot of confusion for people about actually who they are, what family they sit under. So I think that's quite a common problem that people are reporting. So thanks, Caroline. Did you have another point, Caroline?
I've got one more question. I just wanted to put a question out to everyone. You know, we've talked in a lot of detail about lots of things that are going on today. Can you relate to what we're talking about? Does it, you know, how you know, what we're talking about what you're aware of? You know, do you want to know more about it, or, you know, is there anything that you need for obviously we've got this video, but to sort of help share a bit more around what's happening and make it sort of usable, sort of back at base really with working? I'm just wondering if there was any sort of perspective or opinion from anyone about that.
Kirsty, you go.
Yeah, go on, I'll speak and stick my neck out in a forum that I am not familiar with any of you guys. So yeah, you may not want to hear this, but as a lead, first I've heard of all of you guys and all of these things. There's a lot of those slides I really want to look at again. I feel like it's the first time I'm being informed of it all, if I'm honest, and that's down to the lines of communication or possibly work overload, or you know, trying to keep services going through the pandemic, I don't know, but it certainly escaped my attention. I was vaguely aware of some things, but yeah, today's been exceptionally informative because I didn't know before. So I would be really keen for you to think about how you're getting to leads like myself on the ground. I think that's probably an important thing to look at in the future. Would love to be
Thank you.
involved at some point, but
Yeah.
yeah.
I think it's a really good point. And I think that's why we're doing things like these webinars, because we recognise the fact that people
Right.
don't know what work is going on. They don't know who the council are, the faculty are, or HE, and what the work we're doing. So I think this is just the beginning of trying to get the word out there, essentially, so people know what's going on. And I've been working clinically for a long time, but even in Devon, I didn't know what the AHP council was until I came to this kind of role. So I think, you know, it's not any, it's new work. This is where we're starting from, really. So it's a starting place to move forward. But I think it's a really good point. And if you've got any suggestions about how we can improve the communication, that would be great. We've got workforce leads in organisations now who are doing a great job, but they can only do so much. So if you've got any other suggestions, then we're completely open to hear. But I mean, the faculty, just to give a bit of context, the faculty only really was established about 6 or 7 months ago. So we are still very new. The council again wasn't established that much before that, and there's been obviously COVID in between. So this is a work in progress. I think that's really important to say.
Yeah,
Mandy, do you want
just to
in?
add to that, I am involved with NHS England and a DHSC work stream for my clinical field of ME CFS. So I knew those two, but I didn't know there was these other structures wrapped around. And having had a recent NICE review that's impacted heavily on our service, I now know what way that information travels. You know, so you know, that slide was particularly helpful to understand, and it does get me interested in being involved at some point, but I'm not quite sure how or when. But yeah, I'm certainly happy to come to another event maybe or something.
I think the other thing just to say is that Devon is an extremely complex system. You know, there's many systems within or nationally or regionally that only have perhaps 2 organisations working with them. We've got, I think, I can't remember whose slide it was, but someone's slide showed that the complexity of the system. And I think communication is always going to be difficult, and that's something that obviously we're working on and will be improved. So I think everyone's got their hand up. Mandy, I think you had your hand up first. Do you want to go first?
Yeah, it was just to follow on really from what you were saying, in that we do need a multi-pronged attack. So something that we're doing in HEE is trying to get out to all the universities induction to give everybody undertaking a healthcare course an introduction to HEE and what we do and the integrated care systems, and to kind of start to get them familiar with those sort of terms and that terminology. So if we can kind of attack it from all angles, then hopefully we can start to get the word out there in terms of some of the work that we do and you guys are also doing so fabulously in the faculty and the council as well.
Thanks, Mandy. We've got literally 2 minutes left, so I don't know, Rhoda, did you want to jump in quickly?
I was just going to say really quickly, Kirsty, I'll since you work for the same organisation as me, I think I can pick that up with you as well, how we make sure the information that gets spread down to the professional leads gets out to everybody. It's just a timely reminder, isn't it? Thank you.
Yeah, I was going to say the same, but I just appreciate, you know, I asked the question because I wanted an honest answer. So and so that's, you know, really appreciate your honesty on that, and it really helps us to start to put some plans together and work with a wider group of AHPs to get this right and make sure we're involved where we need to involve. But also would love to hear about the work you've been doing around CFS-ME service that you're running with NHS England and things like that as well. So great.
I think the important thing is now hopefully people know who to contact. So if there's anyone's got any questions, wants to know more, then please get in contact with anybody today. I'm sure everyone will be happy to have those kind of conversations. So please do get in contact with us. So I'm just very wary of time and just thinking we haven't got long left. Just want to say a massive thank you to everyone for presenting today, and also the questions. I think it's vital that people do challenge us and give us ideas about what we need to do better. So please don't think it's a negative, it's a real positive. So thank you very much for your contributions. And just a final plug, I'm going to put back up the webinar series. So these will focus much more on the support worker framework. So the second one on the 31st of August is very much for support workers. So please do encourage your support workers to join that one. We've got a couple of support workers presenting, they're working in quite advanced specialist roles. So I think it'd be quite interesting to hear from them. I said the following one will be for managers and AHP leads, and then the final one is for supervisors really. So please do come along and join them. Yeah, hopefully see more of you then. And yeah, thanks for joining. We'll send out the slides, and the recording will be uploaded to YouTube. Fingers crossed if I can get it working. So
Thank
super.
you.
Thanks very
everyone
much,
for coming.
everyone. Thank you
Thank
for giving
you.
your time.
Bye.
Bye bye.
Take care. Bye. Have a good afternoon, everyone. Take care.